Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. First line, pharmacotherapies. First line, pharmacotherapies for the smoking cessation. So first will be the NRT. NRT stands for the nicotine replacement therapy. NRT is nicotine replacement therapy, NRT. So mechanism of action is provides a controlled amounts of nicotine to reduce the withdrawal of the symptoms and cravings. So controlled amounts of the nicotine. So controlled amount of the nicotine is given to reduce the withdrawal symptoms and craving. So dosage and administration, it is the various forms of available. So various things are available. So what are they? It can be in the form of a patch, it can be in the form of the gum, it can be in the lozenges, the nasal spray, as well as it can be as a form of inhaler. Now the adverse effects. The adverse effects is that there can be presence of the local irritation and there can be presence of the nausea, the headache, as well as you can have insomnia. Now moving on to the bupropion. So bupropion SR. The bupropion SR, the mechanism of action is that the norepinephrine as well as the dopamine. Norepinephrine. So norepinephrine and the dopamine. Norepinephrine and the dopamine reuptake inhibitor. Next is the dose and the administration. The doses, it includes the initial dose. So you have the initial dose is about 150 mg and this is once daily. So you have 150 mg once daily and this occurs for 2 days. So 150 mg once daily for 2 days and then 150 mg twice daily. So 150 mg, this is twice daily. So going back, the bupropion, the initial day is 150 mg once daily. This is for 2 days and then 150 mg twice daily. And then comes the adverse effects. The adverse effects is that it includes the dry mouth. There is presence of dry mouth. Next comes the presence of insomnia. So there is dry mouth, there is insomnia, as well as there is presence of the headache. Next is the nausea as well as the presence of the weight loss. So all these are seen. Next, moving on to the varenicline. So here it is nothing but a partial, it is a partial agonist and it is at nothing but the alpha 4 as well as a beta 2. So alpha 4 beta 2 nicotinic, alpha 4 beta 2 nicotinic acetylcholine receptors. So the dosage and administration is first you start with 0.5 mg. This is once daily you administer 0.5 mg and this is for into 3 days. So 0.5 mg once daily for 3 days and then you go to 0.5 mg. So 0.3 mg, start with 0.5 mg once daily for 3 days and then 0.5 mg twice daily. Next, the adverse effects, again it includes the nausea. So there can be nausea, there can be insomnia, as well as there is presence of headache, there is abnormal dreams, as well as the depression can be seen. To learn and grow daily like this, please do subscribe.